We press on for you because it's our mission. Dedicated to investigation because the facts matter. Fueled with determination because it's our calling. Driven by passion because you deserve to know what's really going on. Please support real journalism. We press on for you because it's our mission. Dedicated to investigation because the facts matter. Fueled with determination because it's our calling. Driven by passion because you deserve to know what's really going on. Please support real journalism.
Welcome, everyone. 2021 marks the 6th year for our Atlanta Journal-Constitution Aging in Atlanta program. We're bringing you the first of 2 virtual spring events today. Our panelists will be speaking on a variety of topics: estate planning, managing health and wellness, Medicare, and aging in place. Everyone will make their own introduction, and then I will have a conversation with each panelist for a few minutes. Before we begin, I want to thank the sponsors who are making this broadcast possible today: Kroger and Wellstar Health System. And here are a few words from our presenting sponsor, Kroger.
Kroger is a proud presenting sponsor of the Aging in Atlanta series. Shopping for your groceries and essential household items is even easier with pickup. Whether you're home or finally hitting the road for a getaway this spring, just shop online, choose a pickup time convenient for you, and the Kroger team will carefully pick out your order and bring it to your vehicle when you arrive. So the next time you're ready to shop at Kroger, take advantage of free pickup. It's just another way Kroger is fresh for everyone.
Now, let's meet our panelists who will introduce themselves. First, Shannon Pauley.
Good day. My name is attorney Shannon Pauley. I am a managing partner of the Estate and Asset Protection Law Firm. We are an elder law and estate planning firm in Metro Atlanta, and we're proud to say that we focus on ensuring care, comfort, and independence for our clients by ensuring that they age with dignity and grace.
Thank you, Shannon. Next, Dr. White.
Good afternoon. My name is Dr. White, Dr. Osei White. I'm a geriatrician, internal medicine physician. I work with Wellstar. I've been practicing for about 5 years now, and I did my training in Syracuse, SUNY, upstate New York. I look forward to meeting as many patients as possible and treating as many of you as best as I can.
Thank you, Dr. White. Next, Michelle Blaylock.
Hi, I'm Michelle Blaylock. I am a Kroger pharmacist leader with Kroger Company. I have over 20 years of clinical experience with pharmacists, and I enjoy really working with the community. I've done my undergrad and pharmacy work at Mercer University and really enjoy working with our seniors in immunizations and biometric screenings.
Thank you, Michelle. Next, Dr. Graves.
Hi, I'm Dr. Paula Graves. I'm a practicing OBGYN. I'm Chief of Women's Service Line for the Wellstar Health System. I have been a practicing OBGYN and part of the Wellstar family for over 25 years. I'm originally from the Republic of Panama, but I've been here most of my adult life, and I completed my residency program at University of Tennessee, Knoxville. Our passion is to care for women from all walks of life, from all socioeconomic backgrounds, and also from every phase of a woman's life, from after puberty to past their menopausal status. We enjoy listening to women and caring for women during their reproductive lives, and so we are very happy to be part of this community.
Thank you, Dr. Graves. Next, Alan Young.
Hi, I'm Alan Young. After serving the military for about 5 years after college, I founded over 10 companies, mostly in the home improvement and services space, companies like home cleaning, carpet cleaning, pool cleaning, home automation, home air purification, gutter cleaning, and cabinet manufacturing. But my favorite one, which makes the biggest impact for our clients, is in the aging in place and home organizing industry, Art of Drawers, which is my passion, where I spend most of my time.
Thank you, Alan. And finally, Bonnie Dobbs.
Hi, I'm Bonnie Dobbs. I found out firsthand just how confusing Medicare can be when a family member developed Alzheimer's, and while visiting memory care and nursing homes, ever since I've been on this eternal search to learn everything I possibly can about Medicare. And now I teach classes, workshops, panel discussions, and I would be happy to come out and speak to your group or organization. My agency, Medicare and Other Red Tape, consists of 16 brokers, where we offer all plans with all the major carriers. We're located in several states. And I'm honored to say that I have been on all of the Aging in Atlanta panel discussions for all 6 seasons.
Thanks, Bonnie. Welcome to all of you. And as you can see, we have a fantastic panel of experts, and we're going to have a great conversation. So we're going to jump right in, and I'm going to start with you, Shannon. What are the basic estate planning documents everyone who's over 18 should have, and why?
So the 3 basic documents everyone over the age of 18 should have. First starts with a financial power of attorney. So a financial power of attorney is extremely important because it's where you're declaring out an agent that's going to handle your financial and contractual affairs if you become incapacitated or unable to perform those type of services. It's given them the ability to not only access bank accounts, but enter into contracts and to get you out of contracts. The second is a healthcare power of attorney with medical directive. Just because of the relationship being your over 18 child or your spouse, that doesn't give them immediate legal entitlement to be actively involved in your healthcare decisions, your healthcare treatment plans. And further, I think it's very important through our own independent thoughts and wishes that we declare out medical directives. And that's exactly the importance of this document, where you're declaring out a trusted individual to be not only your healthcare advocate, but also to ensure that your wishes are met with your providing physicians. Then lastly, everyone over the age of 18 should have a will. The mere fact that you may think you have nothing, that doesn't mean that you won't need to go through probate, for example, with a wrongful death action or etc. And I think everyone should have a say-so as to where their stuff goes so they can ensure that they're providing for their loved ones.
So Shannon, let me follow up on that will question. You said everyone needs a will, but for some people feel, hey, my family knows what I want to happen when I pass, and what is probate? You mentioned that, and why do I want to, my those left behind? Why do I want to help them avoid that?
So let's start with the comment that I do hear quite often. My kids know what I want. They know where I want my stuff to go. Why do I need a will? Why do you need a will? Is simply because the people that you know at your deathbed are not always the ones that are in further existence after your passing. And I think it's important that you state out where you want things to go. Otherwise, you're leaving your family in turmoil. You're going to have one person feeling overly bossy and the other one feeling as though they're not being taken care of. These are your assets. This is your destiny. This is your legacy. You need to declare it. That's the kindest thing you can do to your loved ones. You're preventing inter-family squabble. Now, one of the things about probate is that a lot of people have a misconception that a will is a ticket out of probate. It's not. A will is basically your roadmap where you're telling the probate courts any assets in your individual name at time of death, where you ultimately want them to go to. Why do you want to avoid probate? Probate is a lengthy process. It's going to take a minimum of 6 months. And today, in our post-COVID environment, we have certain counties in Metro Atlanta stating when you're filing a probate action to wait 3 years for the conclusion. That means you are leaving family members handling your affairs for up to 3 years after your passing. I don't think that's your intention. Your intention is to make sure that you're providing for your loved ones and that they are able to grieve after your passing, not stressing out about some process called probate that, oh yeah, don't forget that your creditors got to get notified. Your creditors are going to get paid for your loved ones. Court's going to get their money. If the court appoints someone, they're going to get paid. So at the end of the day, there's so many other strategies instead of leaving it up to the courts to determine your post-death legacy that I say avoid it for the love of your family for the comfort and the ability for them to grieve, and also just to ensure an efficient administration of your estate.
Thanks, Shannon. And I guess since people are hearing the background noise, we can go ahead and let them know. Shannon was so determined and helpful to be part of this program. She's actually coming to us from I think a spot at the airport. So thanks for sticking with us and being available. So I want to ask you this question. You talked about power of attorney and how important that is. What can happen if a person doesn't do that?
So let's talk about a financial power of attorney. And this is the example I love to give people. I can guarantee you, if I asked right now for all of our listeners and even panelists that have ever had a cable bill and ever had cable, that they would raise hands. Most people would. Now, have you ever tried to cancel your cable subscription? Do you know how difficult that is when your name is on the policy or in the account? And we know cable's not cheap. Cable's like $225 and up. Well, imagine that $225 is the difference between a prescription copay and not having a prescription copay. It's important that you be able to cancel out of that contract. If you don't have legal entitlement to discuss it, what are they going to tell you? They're going to tell you to pound sand. But guess what? First of the month, they're going to pull out that $225 or $250. So in order to handle something as basic as that, as an example, you need that financial power of attorney. In addition, let's talk about the healthcare power of attorney. You have certain people in your life, your spouse, your children, your parents, they're your loved ones. You want them to be actively involved in your healthcare. And if you become incapacitated, and if you do not give them that legal entitlement, they have no right to have access to your medical records. They have no access to or right to discuss medical treatment plans with your doctors or make healthcare decisions. Then lastly, in regards to the medical directive portion of your powers of attorney, is the kindest gift that you can give your loved one. Imagine this, you're sitting here, you right now are in a permanent vegetative state, you're not responding to external stimuli. The doctor walks up to your family member and says, okay, what do we do next? By giving your medical directive, it's not going to make it easier, but they're honoring you and you're giving them directions so they know wherever you are at that moment, they make that decision, you were actively involved in it.
Shannon, thank you so much. I mean, in such a short time with just a few questions, I think you've gotten across fantastic information. And thanks for going through so much trouble to be with us. We really, really appreciate that. Thank you.
Much appreciated. Thank you.
Okay. Now, next up, we have a message from our gold sponsor, Wellstar Health System.
At Wellstar, our mission is to enhance the health and well-being of every person we serve. Nothing, not even a pandemic, can change that. Since the first COVID-19 case in Georgia, our experts have taken extraordinary measures to keep patients safe. As we move forward into an era of healing and hope, our top priority remains and will always be you. Wellstar. More than healthcare. People care.
Welcome back. And now let's chat with Dr. White about integrating care partners. Dr. White, a question people have, do they need a geriatric physician as well as a regular primary care physician?
Well, I guess the short answer, because I am a geriatrician, would be yes. However, there are some doctors as primary cares who have a geriatric focus, but they don't tend to go into as much detail as a licensed geriatrician would. So I do think in some aspects, you can get a geriatrician who will do a lot of the things that a primary care can do. But definitely when you get to 50 to 55 and up, I definitely would recommend a geriatrician be a part of your care team.
So what services does a geriatric physician provide that my regular doctor wouldn't provide, and what benefits are there for me for that?
No problem. So generally, I think first it's important to highlight what a primary care physician would do. So in addition to diagnosing and treating preventative causes or preventative measures for diseases, a lot of their focus is going to be on primarily those things. When you look at geriatric care, we have more of a comprehensive approach to things. So we do everything from medical assessments, diagnosing illnesses. A big part of our assessment is going to be medication reviews and assessing for drug-drug interactions as well. We do assess things from a mental standpoint, looking at cognition. So I often do mini cogs and mental status exams in my practice as well. We look at the physical aspects of the care, which have to do more so with functional status. activities of daily living, instrumental activities of daily living, assessing gait and fall risk. And then we try to assess the environment to bring everything together to try and make a safe environment for the patient to limit falls, limit injuries at home. And then we also, to hit on what Shannon pointed out, we do address advanced directives as well and try to connect in the correct places to address things like financial power of attorney, wills, et cetera.
And how do you interact as a geriatric physician? I mean, with other doctors?
So as young as I appear, I do go about things the the old school way. I do just pick up the phone and I talk to physicians. Or in this day and age where we have Epic, we can have integrated care by way of the EMR. So we send a lot of messages between ourselves and specialists as well.
Now, we have one question from a reader, I guess more of an observation, that they're having a hard time finding a geriatric physician. So what do you recommend for someone who's following your advice and wants to find someone like you, I guess?
Yeah, we are as rare as dinosaurs, I think. But the good news is that there's younger physicians coming out, like myself. You can always come and visit me at the WellStar Clinic. I am at 3825 Medical Park Drive as well. However, if you're too far from me, then one thing that I often do recommend is contacting your insurance, and they can actually provide you with providers in your coverage area and refer you thereafter. However, you can just Google and find a new doctor, but I'm more than willing to see all the patients that are out there.
So since you just made that offer, we've got some questions people want to ask your advice. So here's one of them. What medical concerns should be the priority for an older adult? In other words, what screenings and other things should older adults be scheduling and have in mind?
No problem. So generally, I mean, looking at the list, when you're looking at the insurance coverages, they have care gaps. And what we try to meet is the basic things that a patient would need on that year-to-year examination. So for 65 and ups, especially females, bone mineral density or DEXA scans to check for osteoporosis or osteopenia. We do blood pressure screening every year. Diabetic screening I do every 3 years, sometimes yearly, depending on the risk. Mobility assessments, and I usually do that through a get up and go test, 6-minute walk test. And I do that yearly as well. Now, looking at vaccinations, I try to make sure I catch everybody up with things like their shingles vaccinations. So the Shingrix for 50 and up, your flu vaccinations yearly, pneumovax every 5 years, and then your Tdap every 10 years. Tdap would be your tetanus shot with acellular pertussis if you have grandkids, young grandkids, or your regular toxoid tetanus shot. Now, to expand a little bit more for the comprehensive assessments, for smokers, we look at AAA screens with or abdominal aortic aneurysm screens, with ultrasounds, depression screens. I do hepatitis screening in anybody 18 and up, but in elderly patients especially. For chronic smokers, more than 30 pack years, I now do low dose CT scan screening looking for malignancy. Mammograms every year, 1 to 2 years for our female patients as well. Now, in more of a niche kind of area, we also focus on our skin exams, looking at melanomas, eye exams yearly, your cognitive screens, thyroid screens, and then obviously the all-important colonoscopy screening, which is 5 to 10 years, depending on the risks.
Okay, well, that's a long list. I have a very direct question here from one of our readers. So I'm literally going to read it to you. It says, I am 62 and have not been to a doctor in a year. What care should I prioritize now that I'm fully vaccinated against I assume against the COVID virus in this case?
Yep. So we've seen this question quite often in my clinic. And what I would say in the last year, a lot of things that have been lagging have been the cancer screening. And I would obviously prioritize that first. So if you're due for your colonoscopy, your mammograms, any skin examinations, I would make sure those are up front. Now, looking at the other things, I would kind of reference that extensive or exhaustive list that I provided for you, which would be the bone mineral density scans for 65 and ups, making sure if you're a smoker, your low dose CT scan screening, And then diabetic screening as well, making sure we're on top of that. And obviously blood pressure, dietary things. So those are the things I would kind of start with and then work from there.
Okay, we can sneak in one more. I think we have time. And again, directly from another reader. I find that my skin has become more fragile as I age. Is there anything I should be doing or taking to prevent this from getting worse?
So yeah, this is another common question that we see often in the clinic as well. It happens commonly in our elderly population due to aging. What I would normally recommend first is conservative things. So, not showering with very hot water, lukewarm water, making sure you're not overdoing it with the showers on a day-to-day basis, not using too many hard brushes on the skin when you have in the shower. After you come out of the shower, making sure you apply an emollient. That'll be a topical moisturizer. Good ones that I often recommend, obviously the good old-fashioned Vaseline, and usually would add that with your cream. Or you can add Aquaphor, which is a good emollient and helps preserve the moisture. And then add in something like Eucerin for dry skin. That's quite effective. Now, usually when it gets beyond that and it's not as effective, we can look at topical tacrolimus, vitamin E ointments, but I usually work with a dermatologist hand in hand at that time if that's needed.
Well, Dr. White, thanks. That was about as information-packed a few minutes as we could have possibly hoped for. So thank you for that.
Thank you, Kevin.
Another thing I wanted to mention is thanks to Kroger, we'll be drawing 2 random winners of a $50 Kroger gift card from those of you who registered for the event today. You'll be notified if you're a winner after the program. Next up, we have Michelle Blaylock from Kroger. So Michelle, here's a real straightforward question. Allergy season, exactly when is it? Because sometimes it feels like year round.
That's a great question, especially with allergy season springing upon us. And actually, it just depends upon where you're located in the United States. Allergy season can usually begin here in February, last into even late fall, and it depends upon what's actually pollinating. So we start with the trees pollinating around February all the way up until April, and then we have grass pollination that lasts through spring and summer, and then into late fall is when ragweed comes into play. So it really just depends upon where you're located and what you're most sensitive to.
Now, can certain foods and drinks make allergies worse?
They can. That is something that maybe people don't necessarily think about, but actually things such as alcohol, processed foods, sugar, peanuts, wheat, even raw vegetables and fruits can irritate your allergies. And sometimes even that cup of coffee in the morning can actually worsen your allergies. So that's just something to think about as you're going through your day.
So what you're saying is if I'm having an allergy problem, maybe pay attention to see if my cup of coffee triggers it or it's somehow worse after I drink the coffee. Is that what you're suggesting? Something like that?
That's exactly
Okay,
it.
thank you. All right, so I have another direct question from a reader for you as well. What can I do to avoid allergies to tree and grass pollen?
That's another great question, especially as those are springing up and we've got a lot of people in the pharmacy looking for those remedies. So some of the things that you can do is just know when to go outside. So if it's going to be a dry, windy day, you might want to avoid going outside. The best time to go outside is actually after a rain and the rain has washed away some of the pollen. Other things that you can also do is be cognizant when you're walking into your home. Shower is a good thing. Sometimes people don't realize that pollen will stick to your skin and your hair. So it would be a good idea to change your clothes, shower. You can even wash your linens usually once a week. Sometimes people don't realize that it will get into your bed sheets and start irritating you. The other thing to do at your home is be cognizant of your air filters. So make sure to change your air filters pretty regularly, and that will also keep your home healthy.
And if I want medication and I'm really battling my allergies, what over-the-counter recommendations do you have particularly for seniors in this case?
Sure. There are several over-the-counter medications for allergies. They come in all kinds of forms. We have allergy medications as antihistamines, decongestants, nasal sprays, and even eye drops available for allergies. However, I would recommend that you consult with your physician or your pharmacist because a lot of these medications can cause side effects as well as interact with some of your other maintenance medication.
Okay, thank you, Michelle. Now, another thing that's really come up through the pandemic and I think continues is the contactless option for accessing prescription medication. So talk about that a little bit, and how to make sure that if you've got that concern, even ongoing, not just with the pandemic, but with just being awful careful with your health. I mean, tell me what to do when I show up, I think is what I'm really asking.
No problem. Absolutely. So Kroger, during the pandemic, we have instituted, we waive delivery fees for anyone with a prescription all the way up until May 31st currently. So a lot of times you can call your pharmacy, and in some areas, even if it's before 11, same day, if not next day, free delivery at this time for those prescriptions. There are also Kroger locations that have drive up and walk up windows. So that kind of limits your contact of being in the store, as well as we have added online pay. So you can be able to pay for your prescriptions and reduce your contact at the store as well. So those are some things we're working with as technology allows us to do so.
Thank you. Okay, so I've got another one, exactly reader question. I'll just read to you. What about getting vaccines that I've put off, like shingles? Is it safe to get those after my COVID-19 vaccines?
Yes. So the CDC current recommendations are to separate any other vaccine from your COVID-19 vaccine for 14 days. And that really doesn't have to do as much with efficacy, but more of if you're going to have an adverse event, we want to be able to identify which vaccine gave you that adverse event. So 14 days is the recommendation between any vaccines and your COVID vaccine.
Okay, so this final question, Michelle, for you, which is one I think that we all have and usually comes up in these sessions, which is, what's the best way to get rid of prescription medication after it's either expired or you don't need it anymore?
Best way to get rid of your medications, whether it be expired or not to expose them to the environment, is really to reach out to your local law enforcement first. Many police stations will be able to take back medications. I would also check on the DEA website. There are several events that will be held in communities and pharmacies and other areas where they will set up a station for you to take back medications. So those are on certain days. So check on takebackdrugdea.gov, and they will be able to give you information on those sites. The other thing that you can do is contact your pharmacy and see if they have sometimes programs that will help you with that. If you do not have any programs local to you, you are able to dispose of it at your house. I would remove any type of patient information from any of your labels. You can take the medication, put it in a sealed container, a plastic bag, and crush it and maybe mix it with either some dirt, cat litter, coffee grinds, something like that, so that it does not get into the system, and then you can dispose of it in your trash. So those are some other ways that you can get rid of your unused medication safely. You definitely don't want to be flushing it down the toilet or doing anything like that.
Thank you so much, Michelle, for that, all that practical and useful information. Now we're going to talk to Dr. Graves, and we're going to discuss women's health. So Dr. Graves, I have a lot of really good questions directly from readers here. So let me start with this one. What is the role of a gynecologist for women over 55?
So that's a great question. A gynecologist is a doctor that specializes in women's reproductive health. And so we address some of the most important questions in our health issues in a woman's lifespan, such as breast health, abnormal bleeding, pelvic pain, pelvic prolapse, menopausal issues. We also screen for various cancers, we treat infections, and we perform surgeries for pelvic organ problems or urinary tract problems.
So, Dr. Graves, what are the most important numbers for women over 55 to monitor, and which tests do you think are really important for them to have on their radar?
Another great question. I want to, first of all, preface this by saying that healthy women are the cornerstone of a healthy society. And so our purpose as gynecologists is to empower women to take control of their health. Women drive the rest of the members of their family and in the community in obtaining help, but many times they forget to care for themselves. And so a couple of numbers such as blood pressure, and I want to recommend everyone listening to me, especially women, get a blood pressure cuff. They're not that expensive. weight, especially during COVID. Many of us have increased in weight, but more importantly, there's a number called the BMI, body mass index, and there are many calculators out there that you can obtain to calculate this. And you need to have your weight as well as your height. So let's talk about height. Height is important because as women age and as their estrogen levels decrease, they're at an increased risk for osteoporosis. And sometimes the first sign is decrease in height. And so many women do not measure their height. And so the assumption is that they think they're 5'3" throughout their lives, and they're not. Let's talk about waist circumference. So I recommend women to just take a twine, piece of cord, and to wrap it around just right underneath the belly button, and just measure the waist circumference. It should be less than 35, because greater than 35, there's risk for other diseases that has been shown, such as diabetes and heart disease. Another very good number, their last menstrual period. The fact that many women are still having cycles after 55, it could be that they have not been, they're not menopausal yet, but it also could be a sign of bleeding, of abnormal bleeding. Other numbers, cholesterol, their thyroid, their hemoglobin A1C, which is a measure of blood sugars. Those are all numbers that women need to know.
Thank you, Dr. Graves. A lot of information there. Wow. So here's another one directly from a reader. At what age can women stop getting cancer screenings?
So several cancer societies have cutoffs. So speaking about cervical cancer, we'll start with that one. The cutoff for screening for cervical cancer should be around age 65 if that woman has been getting regular cancer screenings, or if there's no immunological disorders that woman has that could increase her risk for cervical cancer, but usually around age 65. For breast screening, usually around age 75 or 80. If, however, it can be longer if the longevity has been shown to be greater than 10 years. If that woman shows because of health issues that her longevity is going to be greater than 10 years, then it makes sense to continue screening for breast cancers. But that decision should be what we call a shared decision-making between the patient, the woman, and her provider. Colonoscopy. So colonoscopy is really important. The African American population should begin screening around age 45. And the recommendation is usually that if everything is okay, may stop at age 75. So those are the basic screenings. I do want to say that in addition to cancer, it's really important for women to screen against sexually transmitted diseases. That's something that we don't talk about. They're on the rise, and it can affect any woman, even after 55. I don't want to leave out skin cancers. And that's an easy one to do, to always be aware of different new abnormal moles that may show up in your body. A great recommendation that someone gave me is to have a friend or a partner take a picture of your back, because we cannot look at our backs. And that way, every year, we can see if there are any changes regarding our skin health.
Dr. Graves, here's another question directly from one of our readers, and let me read it. I have heard that mammogram results might be skewed after the COVID vaccine. Is that true?
That is actually an excellent question. So the Society for Breast Imaging recently found an uptick or an increase in axillary lymph node enlargement in women getting their mammograms, and especially if they'd had COVID. Specifically, they found that these lymph node enlargements were occurring on the same side or the same arm or under the armpits where the women obtained their COVID vaccine. And usually lymph node enlargements are very rare. And so we realize that this is a transient enlargement, it goes back to normal within weeks after the vaccine. So the recommendation is this: if a woman has not obtained the COVID vaccine as yet, go ahead and get the mammogram. However, if a woman has obtained the COVID vaccination, she should wait 4 weeks after the second dose of the vaccination to obtain a mammogram.
Dr. Graves, I have a 3-part question for you, and I want to get it just right. What is the average age of menopause? What are the symptoms of menopause? What should women do if they are having menopausal symptoms?
The average age of menopause in the United States is age 51. However, that is average. So it can occur as early as after 40, and it can go on to as late as close to age 60. The symptoms of menopause are very vague, but every woman needs to know just in case. So symptoms such as hot flashes, night sweats, mood changes, irregular bleeding, those can all be symptoms of menopause, but it's very important to consult a doctor regardless, because these symptoms can also be symptoms of other diseases, such as thyroid disease. And rather than assuming that it is menopause, which is a natural occurrence in a woman's lifespan, it's really important to contact a physician to rule out other diseases. So what happens if we are having menopausal symptoms? For hot flashes, one of the things that we recommend is definitely increase hydration and diet. Eat a diet that is richer in protein and vegetables rather than carbohydrates that can cause us to crash and burn. And make sure that our blood sugars are well maintained. Wear clothing so that if one feels hot, you can take a jacket off, and if you then become cold, you can put it back on. But the most important thing, however, is maintaining hydration. And definitely to consult a gynecologist, because there are medications, some of them over the counter and some of them prescription medications that we can give our women if they are experiencing various symptoms during this period. And some of them can be debilitating. Most importantly, listen to your body, trust your instincts, and have an open discussion with your gynecologist.
Thank you, Dr. Graves. Just a lot, again, of very good and practical information. We're going to take a quick break at this point in our program, but we will be right back.
Imagine retirement living at its best, doing what you want to do every day. The newly opened independent living apartment homes at the Villas at Canterfield have it all, and it's all included in your monthly fee. Enjoy 31 gourmet meals served in the restaurant-style fine dining room. Play a friendly round of cards, a challenging game of billiards, or enjoy happy hour with your friends in the cozy club room. Work out at your own pace and on your own schedule in the upscale fitness center. Swim laps in the heated covered swimming pool, or feel free to lounge away your afternoon poolside with a good book. Oh, and don't forget our on-site beauty salon, concierge services, and scheduled activities with transportation. Did I mention the movie theater? And when your active day is through, relax in your graciously appointed apartment home where every detail has been carefully planned with your comfort and contentment in mind. And your apartment home brings new meaning to the term maintenance-free, because weekly housekeeping service is included. The Villas at Canterfield offers refined retirement living at its best. And for you, your best days yet to come.
Now, turning our focus to the home, welcome Alan Young. Alan, my first question, talk about the concept for your business, Aging in Place. It seems like we hear that phrase a lot.
Absolutely. It's becoming more and more prevalent. Aging in place is actually an official term defined by the CDC as the ability to live in one's home and community safely, independently, and comfortably, regardless of age, income, or ability level. And a couple stats, according to 87% of seniors want to age in place instead of moving into a nursing home or assisted living facility. And if the trends continue, the number of Americans over 65 will almost double from 37 million and reach over 71 million people. In addition to that, 70% of people between 50 and 64 would prefer to live that lifestyle as well. And as our technology continues to advance, we're able to remodel our homes to make our lifestyles easier.
So picking up on that, I think one of the things we all realize is that as we get older, our kitchens become a potentially dangerous place for us. How do you make them safer? How do you keep that from becoming the dangerous room in the house?
Yeah, it is the most dangerous room in the house. After age 65, falling becomes the leading cause of death in the home. And it's such a prevalent cause of injury that most aging in place modifications are made with that in mind. There's three areas that I'd like to focus on. There's a lot of different areas, but the three top areas, first one is flooring. No matter what your budget, make flooring the top priority in your kitchen. Any floor covering that you have should be non-glare. And please don't even think about incorporating rugs as part of your kitchen flooring aesthetic. There's a reason they're called throw rugs. Tiles or stone should be kept small. The less distance that you have between tiles, the lower chance of a slip and fall accident. And that said, choices like vinyl, wood, linoleum flooring are usually the best options for aging in place residents and are much easier to roll a wheelchair over tile and carpeting. Countertops, choose a surface with ease of use and maintenance in mind. And you may want to overlook that great looking granite countertop for a more practical material. Along the edges of the countertops, there should always be an emergency grab handle within reach. Many home installers can place a single handle along the entire countertop. Sinks and faucets, hands-free faucets are great. I don't know if you've seen them before. If you haven't, you can actually wave your hand over the top of it and it turns off and on. If that's not an option, choose a lever-handled faucet mounted on the side of the countertop. And also having a pull-out sprayer is also a great option. And the most important feature on a sink should be an anti-scald device.
Well, of course, those kind of investments are important. But a question I think everyone has is it hard to maintain once you make that kind of commitment in your home? Does that make it hard to maintain, or what should we keep in mind as we maintain those things?
Not really, other than things like automated light switches, which are connected to the internet. I think we all know how much fun technology issues can be as we age. Maintenance on all these items are very easy, and most of the things that you buy, and especially ones you get installed, have great warranties.
Okay, so here's a question directly from one of our readers. So I'm just going to go ahead and read it. As I get older, I find myself less able to maintain organization throughout my home. What steps should I be taking now to get more organized for the future?
Yeah, first, I would say get rid of anything that you don't use frequently. As we get older, we tend to accumulate. Marie Kondo is one of my great favorite organizing experts. You can see her Netflix show. She's got a lot of information out there, but she talks about joy. So anything that doesn't give you joy or that you need to use in the kitchen, get rid of it. Think smooth workflow. Look at everything at once, not just cabinet to cabinet, and look at organizing everything in the right area. So in your cabinets, look at where you prepare your food, where you store your food, where you cook and clean, and have those items in there. In my company, we had a lot of pull-out drawers and custom inserts into your existing drawers. And that's a great way to organize what you have and make it easier to find. A custom drawer company for your kitchen and bathroom, and also a professional organizer for the rest of your house is a great way to get the rest of your organization done in 2 easy steps.
Thank you, Ellen. A lot of really good, very practical things that people can get going on well before they find themselves in either a crisis or in a hurry to get it done. So thank you. Mm-hmm. Next, we're going to dig into some Medicare questions with Bonnie Dobbs, who's a really real expert in this area. So Bonnie, we're going to start with some questions that readers sent us because we think they're good ones. And here's the first one. I've heard there are lifelong penalties for not registering for Medicare on time. How and in what format do notifications come from Medicare in advance of the deadlines for people so they can avoid this penalty?
You know how some days you feel like Albert Einstein and other days you feel like Forrest Gump? Well, that kind of explains how learning about Medicare makes you feel, because some parts of it make sense and other parts of it, it's like you can't make heads nor tails of it. So actually you have to seek out your own information. And that's why so many people end up having a gap in coverage or getting a penalty. So my best advice is to go to Medicare.gov, read the information there. There's also a book that's published by the CMS. It's called Medicare and You. That's a good option for lots of information. However, that same book will cure insomnia, if you know what I mean. So it's like all facts. Or you can call my office and we'll make it easy by walking you through each step and teach you about Medicare and hopefully have some fun along the way. So there is no easy way to find out about Medicare though. And they're not going to be like sending you emails, or it's not, you don't get any notifications like, okay, now you have to enroll or get a penalty. So you have to do your own research and learn yourself, unfortunately.
Well, thanks, Bonnie. And I'm going to follow that up with another reader question. I am over 65 and on my working spouse's health insurance. Is there anything I need to watch out for when I do sign up for Medicare Part B to avoid a penalty?
Yes. I always like to start working with clients about 3 months before they become Medicare eligible, because penalties are for as long as you have Medicare. And how long are you going to have Medicare? As long as you live. So if you are past 65, you need to complete a form called the L564, and you can get that by going to the Social Security site and finding that. You have to have your employer or your spouse's employer complete that form. Once you have that form completed, then you go back to the Social Security site, you input your information, that is a fillable form, and you upload the form that you get from the Social Security office. That way you can apply for your Part B. And when your Part B becomes effective, or when it has been confirmed, at that point, you can apply to get a plan. So that takes several weeks, actually, because usually it takes about 5 days for an employer to get that information to you. Then it takes about 10 days for the federal government to actually get you in the system. So just remember, you're working with the federal government. They don't move too fast, and you do have a brief window of time to enroll when your employee insurance terminates. So my best advice is start 3 months prior.
Okay, 3 months prior.
Yes.
Okay, so those of us who watch cable news or pay attention to that, we can't quite get away from Joe Namath almost all day long, it seems. So here's the question. Can anyone get that plan that Joe is advertising, that Medicare plan?
Maybe, because everybody's saying, show me the money. I want to get a plan that adds that $148.50 back into my Social Security check. They also say, I want those free rides, home delivered meals, home delivered prescriptions, dental, vision, hearing, gym, teledoc appointments, and someone to come over on Tuesday, cook dinner, and walk their dog, right? So the truth about that is you must qualify to get that $148.50 back. And of course, that is income based. Okay, so that takes care of the $148.50. Meals are limited to after a hospital stay. You can get mail order prescriptions, and that is offered by most plans, and Kroger offers those. The dental, vision, hearing, and gym is offered through Medicare Advantage plans. And some of the Medicare supplement plans do have limited discounts on the dental, vision, and hearing. Most all of the plans offer the teledoc visits since the pandemic began. So we offer all those plans and can advise you if you qualify.
Okay, thanks, Bonnie. Another question. I have SSI or SSDI. When will I qualify for Medicare?
That's a good question because there's a major difference. SSI is Social Security income, and that determination is based on age and disability and limited income and resources. Whereas SSDI income determination is based on disability and work credits. So SSI recipients qualify for Medicare upon receipt of getting SSI, and in most states, an SSI recipient will automatically qualify for Medicaid, and a person on SSDI, which is the Social Security disability, will automatically qualify for Medicare after 24 months of receiving disability payments. Because if someone has been on SSDI for 24 months, both the federal government and the medical field agree that you're probably not going to rehabilitate. That's a serious one.
Yeah. Okay. Here's I think maybe a simpler question. If a doctor makes a house call, is that covered by Medicare?
Yeah, actually, we've come full circle. Remember, like in the 30s and the 40s when the doctor came to your house? Well, now house calls has been quietly coming back into existence thanks to the aging population and portable technology. And COVID-19, of course, has just brought this way of seeing your doctor to the forefront. It's a safe way of getting in-person care. So what happens is usually a doctor or nurse practitioner use portable technology for a variety of services. They get to see a patient in their home, and that also provides insight on their environment and the need for other services, like they may need imaging, tests, or referrals. But best of all, Medicare pays their portion and you pay a copay. So yes, you can see a doctor in your house.
All right, I'm going to get in one last question here. What do I need to know if I'm turning 65 or getting ready to retire and I'm past 65?
Okay, if you're turning 65, okay, you have the 3 months before, the month of, and 3 months after to get on a plan. If you are retiring after 65, I kind of went over that earlier, okay? You have to prove to the federal government that you have had coverage from the time you turn 65 until the time whenever you are applying for a plan, okay? If you are retiring, you have 63 days after you retire to get your Part B, your Part D, and get your plan in place.
Thank you, Bonnie. And thanks to all of you. Just a really great panel. Here's what I'm going to do. In the same order that I called on you and you each went, I'm going to ask you to give us one final brief thought because we don't have a lot of time. So Shannon, give us your final thought.
There's a lot of legal requirements to ensure that your loved ones will be able to care for you both during life and provide for you after your passing. Do not think that you've stated it once and that is good enough. And don't think that a mere relationship between you and whoever that person is going to give them the rights to be your advocate or protector.
Thank you, Shannon. Dr. White.
So as a geriatrician, I want to say that geriatric care is it's multifaceted. There are many layers to it. Definitely include a geriatrician in your treatment team. If you're having trouble, you can always turn to me. But again, there are many levels to this. And if you need comprehensive care, a geriatrician is where you would go.
Thank you. Michelle Blaylock.
I'd like to say Kroger Pharmacy is really here for your total health care. So we can provide a lot of those vaccinations that Dr. White mentioned. Talk to us about your medications, over-the-counter recommendations. Your Kroger pharmacist is always just around the corner to help you with anything for your health needs.
Thank you, Michelle. Dr. Graves.
Healthy women are the cornerstone of a healthy society. And if I can give one advice is that women listen to your bodies, be empowered, know your numbers, regardless of age. Develop a good relationship with your gynecologist. Get regular screenings so that you can know and have early detection of any disease. And in that way, we can just continue to empower our families to be healthy.
Thank you, Dr. Graves. Alan Young, your turn.
Yeah, just a little bit about cabinets. We talked about other spaces to keep you safe. Upper cabinets, try to keep things out of the upper cabinets that are heavy. And if you have them there, use a pull down shelf. And your lower cabinets, things can be a lot more convenient. They can give you more space, better organization, easy access if you do pull out shelving. And it also reduces back strain. You can find pull out shelves at any major home improvement store, or you can have them built through a dedicated shelving company like Art of Drawers.
Thank you, Alan. Bonnie, you get the last word.
Okay. Just everybody remember that choosing a Medicare plan is one of the most important decisions that you'll make as a senior, and use a broker who can shop all the plans. All of my agents are brokers, and stay connected, enjoy your life. And remember, my last parting thing is laughter is the best medicine, and it doesn't have a $35 copay.
Thank you, Bonnie. In closing, we want to thank our panel. They were wonderful. I told you they were great, and of course they showed you. We also want to thank our presenting sponsor, Kroger, and our gold sponsor, Wellstar Health System, for making this program possible. We'd also like to recognize these supporters of the Aging in Atlanta program. Be sure to visit ajc.com/aging for updates on senior living topics and a recorded broadcast of this event. Thanks for joining us, and we look forward to seeing you again on Wednesday, May 19th, for our next Aging in Atlanta virtual event. We believe these events are part of our mission to keep the community informed and a way for us to give back to you, our valued newspaper subscribers who help fund our local journalism and journalists. Have a great day.